viewers, welcome once again to my YouTube channel. And in succession to the videos what I have been taking up in general surgery, today's topic of the discussion is about the deep vein thrombosis. So do remember the signs what are there in the which can occur in the blood clot can be of a varying degree, and to some extent it can be found that certain clots are there in the blood vessels which can turn into a serious life-threatening conditions. So blood clots in our body can be good or it can be bad. In good, when I say it means simply means that certain blood clots are there which helps to seal off the blood vessels when it is an injury or some kind of a wound is there. Whereas if there are certain steady immobile clots, these certain steady immobile clots, they do not cause any harm, but in certain instances when these blood clots they are transferred from one side to another, such as in the vessels of the lungs or in the vessels of the heart, these blood clots can cause serious life-threatening conditions. So one of the very serious complications of an immobile or a blood clot what occurs in the deep veins, particularly in the legs of the body, is called the deep vein thrombosis. So today's video I'll be mainly focusing upon that what are the most important signs and symptoms what are there when a person is suffering from deep vein thrombosis and how is the condition manifested in certain patients. So when we talk of deep vein thrombosis, firstly we need to understand what the NBCA, that is the National Blood Clot Alliance, has to say about deep vein thrombosis. Deep vein thrombosis, the term itself is referring that there is going to be formation of a thrombus or a blood clot in any one of the deep veins, in one or more of the deep veins what are present in your legs. So, according to the National Blood Clot Alliance, the data what they are suggesting that a person can die of a blood clot even at the age of a minor age of 25 years or even as late as at the age of 85. So, when we look at that a person who's suffering from the deep vein thrombosis, or if a blood clot is there in any one or more of the deep veins what are situated in the legs, the symptoms what can be manifested can be of a varying extent. And when we look at the causes, so what is the etiology, what are the causes what are related to deep vein thrombosis? The most important cause is that there are certain people who are in the habit of sleeping for long hours in one position. They do not turn around while sleeping on bed, and just in single posture they are going to sleep for long hours in the bed. So this is the very important predisposing factor what causes deep vein thrombosis in the legs. Apart from them, the next important cause what can be looked upon as that there are certain people who are in the habit of sitting, and while sitting in sitting posture they are going to sleep for a longer time. So sleeping while sitting also predisposes an individual to deep vein thrombosis. Apart from them, if this condition of deep vein thrombosis, if it is left undiagnosed, this can lead to serious life-threatening complications, and life-threatening situations are there. So it is said that if this deep vein thrombosis, if it is left undiagnosed for a longer period of time, it can cause to serious life-threatening complications. And one of the biggest risks what is seen nowadays is that if this clot is going to migrate through the bloodstream to the vessels of your lung or to the vessels of your brain, that can cause a severe potentiating life-threatening situation. Now, patients who are having this deep vein thrombosis can be identified with the symptoms what are going to manifest in their legs, and here are some of the very important symptoms what can be usually seen and what the patients might usually look for. Firstly, the symptom what can be seen, it is the swelling and pain in one leg. It is rarely in both the legs. Do remember, if the symptoms of deep vein thrombosis is mostly going to manifest as a severe cramping type of a pain, which is mostly seen in one of the legs, and it has been found that the pain is rarely going to manifest in both the legs. Apart from them, the common symptoms can be throbbing, cramping pain in one leg, and particularly the pain what is mostly seen, it is in the calf muscles or in the thigh. The next important symptom what can be looked for, it is the reddened or the warm area around the affected blood vessel, and The reddened area, it is mostly due to the inflammation what is caused. So deep vein thrombosis, this can also lead to the discolored skin due to inflammation, and the affected area of the leg becomes swollen or it hurts even on mild walking. Now moving on to the next important symptom, it is that it can be seen that the veins what are having this kind of a thrombus are going to be swollen, and on palpation, on touching, these veins they become hardened and they are more of a swollen or engorged condition is there. So these veins they are very swollen, they are hard, and they are very painful to touch. They become larger and they are very hard and they are very painful. So you must consult your doctor immediately, and as soon as you develop the symptoms of deep vein thrombosis, you should need medical supervision as early as possible, because earlier diagnosis is ultimately going to prevent from the serious life threatening complications. So students and viewers, this was a very short discussion where I've tried my level best to discuss about the deep vein thrombosis, what the factors, the potentiating causes of it, and what are the signs and symptoms what patients are mostly manifesting. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel and they haven't subscribed yet, go do subscribe the channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.